Hello, it's Wednesday, the 10th of March, and this is just a brief update on the COVID vaccination system for patients and populations served by Wargrave General Practice and the practices of Wokingham North Primary Care Network. So, firstly, some very good news. As you know, we were very early rollout centres for the COVID vaccination programme with a Wave 1 and Wave 2 site within our primary care network, covering the 5 practices of Wargrave, Twyford, Loddon Vale, Parkside and Woodley Centre. That population, about 63,500 patients, are served by the 5 practices. We started the COVID vaccination programme before Christmas with both a Wave 1 and a Wave 2 site, and that proceeded very well into January. But because we were way out ahead of most of the rest of the country, we were a little bit starved of supply from the end of January onwards. While supply was getting diverted to other parts of the country that were significantly behind us. Nevertheless, we were still one of the earliest places in the country to complete our groups 1 to 4, which is all the patients above the age of 70. In late February and into March, the entire system has been experiencing a little less supply come through. That is mainly because they've been re-engineering some of the manufacturing plants so that they can generate much greater supplies from the end of March onwards. So I'm now delighted to announce that our run rate for vaccines is about to probably treble. And we have already started doing second jabs on some of our older population that had their first jabs in early January. We're delivering second jabs between the 10th and the 12th week after the first jab, and that's going quite well. The enhanced supply means that we will be getting significantly more first jabs out as well. Therefore, by the end of next week, we will have completed, we calculate, our Group 6 patients. So these are the patients under the age of 70 who have clinical indications why they are a bit more at risk. It's quite a big group, as you can imagine, but we are ploughing through them very quickly, and that is going to accelerate with this new supply. To give you an idea of the size of the supply, Berkshire West, throughout general practice in Berkshire West, which serves a population of about 560,000, has been getting on average about 11,000 vaccines a week supply. The best week we had was in mid-January when the whole system had about 18,000 vaccines delivered. Our predictions for the next 4 to 6 weeks, however, are we'll be getting 25 to 30,000 vaccines per week. So as you can see, it's quite a significant jump up in supply. Once we finish Group 6, we will finish off Group 5, which are the 65 to 70-year-olds, and then we're into the next groups. We are aiming to try to get all the people in our population above the age of 50 vaccinated by the middle of April. And then we'll start moving into the groups younger than that. As you're all very aware, the risk of adverse effects from COVID infection are heavily related to age. So by the time we had vaccinated all above 70, we'd already probably reduced the risk of death and severe hospitalizations by well over 80%. And by the time we finished those in Group 6, which are the clinically vulnerable, we should have covered almost 90% of those at risk. In fact, probably a bit over 90%. The COVID jab, as you know, is very safe. Some people do experience some slight side effects from it. We reckon it's about 5% at the moment from what we're seeing locally and what we're reading. The most common thing is a bit of a headache, followed by slight achiness, very mild flu-like symptoms. Lasts in the vast majority of cases 24 to 48 hours. There's a tiny percentage who say they still feel a little bit tired in subsequent days, but certainly doesn't stop people getting on with their lives and doing what they need to be doing. It's a very safe vaccine. It has huge benefits in reducing your risk of getting COVID, getting severe COVID if you get it, getting hospitalized, and God forbid, ending up in an intensive care unit or on a ventilator. And your risk of death, if you've been vaccinated, is hugely reduced. So we strongly encourage everybody to take on the COVID vaccination. Hats off to our local population who know a good thing when they see it, and they've taken this up at very high uptake rates. We're well above 90% with our uptake. So thank you all very much for your attention. We hope to be doing regular updates like this, probably on a weekly basis. Our next big vaccination days in Wargrave itself are this Friday the 12th, when we're putting out several hundred vaccines of both Pfizer and AstraZeneca. And then we'll be doing some during the week, starting the 15th. And then on Saturday the 20th, we'll be doing a very big rollout, which will be many, many hundreds of vaccines. So it's all systems go on the vaccination front. One other thing I would like to raise, though, is it's vitally important that we keep trying to go through the routine annual reviews of people with chronic diseases. This is vitally important for your health. The risks with some chronic diseases can exceed the risks of getting COVID if they're not properly managed. We managed to do very well during the few quiet vaccination weeks. We instead put a lot of our energy into chasing up people for their annual reviews, etc. And those figures have come up very nicely, thank you. But again, remember, we're open for business. We are doing business as usual. It is possible to get seen in the practice. We do triage everybody on the phone first because a lot of people find that more convenient and it allows them to minimize their risk of going outside their own homes. But we are seeing people face to face. We have always been seeing people face to face. So hopefully this is a useful update from Wargrave General Practice, and we look forward to seeing you for your jabs or in the practice or just outside in the open air. Thank you very much indeed.